Hello, my name is Kelly McClenaghan. I am the Occupational Health and Wellbeing Lead for the Trust. Today I'm going to give you a brief overview of the services that we have within our department. Many people ask, what is it that Occupational Health actually provides? Occupational Health and Wellbeing is a relationship between health and work, and our service sits in the middle there. This is about achieving that work-life balance. As we all know, especially in these difficult and demanding times, that sometimes to achieve that balance is not always easy. Within Occupational Health and Wellbeing, we promote people's overall health, both physical, psychological and mental wellbeing. It's about protecting the health and wellbeing of our staff. It's also about preventing the impacts of ill health on individuals and supporting them to remain within the workplace. We have various services within the organisation, and these comprise of self-referrals, whereby somebody can make the referral to Occupational Health directly, and management referrals, whereby there is a conversation between the individual and the manager, and they are referred to Occupational Health to have a look to see how work is impacting on their health and potentially their capabilities. We also look after the staff and the need, if there is a need for needle stick, sharps or a splash injury. This is to prevent the potential spread of a bloodborne virus. Some members of staff, unfortunately, may develop skin or contact dermatitis issues, and we provide the health surveillance for that. We also do the pre-employment questionnaires, which I'm sure most of you will have completed. We also do the health reporting for health and safety matters. This includes for the needle sticks. This might be in relation to COSH and some of the chemicals that you may come across within your working life. We also do the display screen equipment, the display screen assessments. Some of you may spend long periods of time sitting at a workstation. Others may use equipment throughout part of your daily working life. And we will ensure that you adhere to the HSE, the Health and Safety Executive Standards. We also do a lot of work with regards to proactive health and wellbeing interventions. As you can appreciate, now more than ever, staff wellbeing is of paramount importance to us. With the People's Plans, the NHS long-term plan, and with our compassionate leadership and our cultures and values that we are looking at, health and wellbeing of our staff is very important. What then do we provide? We have various services across the 3 sites. These include our Employee Assisted Programme, which we currently have at Basildon and Southend. This is a 24-hour counselling service that staff can access. We also have the psychologists based at Broomfield Hospital, where staff can access that within the core office hours. We have our Schwartz rounds. At the moment, these are being done virtually. They are an invaluable tool and have been within the organisation for a couple of years, and they can be really, really helpful when looking at non-clinical support. We also have pastoral care, again across the 3 services. There is our stress awareness training. This is something that we continue to build on. This is something that is very important because we recognise it can be one of the highest reasons for sickness absence within an organisation, and how the importance of that can impact on people's health and their well-being, and going back to that work-life balance. We also adopt mindfulness, and this is promoted on the internet and throughout the different apps that are available to staff. We have health checks across the 3 sites. This might be from an outside provider, or it might be an initiative that Occupational Health and Wellbeing are doing. And we also have the flu vaccinations, which is a campaign that we have every year, and it is so important that every healthcare worker has their flu vaccination to protect both themselves, their patients and their family. We have a system called Live Well. So we have smoking cessation, weight management classes. Again, some of that is provided in-house, some of that is from outside providers who come through. We also have carer support. Again, going back to that work-life balance. It is of paramount importance that people have a good work-life balance. We all have very busy lives. Sometimes that might be through work, sometimes that might be through personal, and sometimes those carers issue can increase that responsibility. And the exercise opportunities. We have a health and wellbeing lead and a health and wellbeing team within the organisation, and they are continually looking to see what services are available both outside and in-house. We have various clubs that people can join and activities that they can partake in. We also have the Cycle to Work scheme, which is currently available through our VivUp on the internet. And then what we have, the area that we class as Work Well. So this is looking at, as we said, we've got access to occupational health across the 3 sites, and your staff physiotherapy. This is for MSK issues, musculoskeletal problems. Unfortunately, within our line of work in the healthcare, people can experience health issues with regards to back, shoulders, knees. You can self-refer to the MSK sites and get some excellent physiotherapy services. We also do the display screen equipment, as I've already mentioned in the beginning, and we have the Guardian service. This is an independent service that people can go to for support if they feel that they have some work-related issues. We also work very closely with our learning and development team, and we are part of that group to look at developing our staff, to keep our staff both healthy physically but also healthy mentally, and that can sometimes be looking at the training that is outstanding. The other thing that we also look at and that we have a lot of support for is the different diversity groups within the organisation. That is a brief overview of the services that we provide within the organisation here in Occupational Health and Wellbeing. Thank you.